Welcome to the Doctor's Podcast, Health Tips Weekly, Episode 5, Menstrual Cramps. Before we start this week's episode, here's a disclaimer. The term women will refer to patients who experience painful periods. However, we recognize that not all people who experience painful periods identify as women, and we encourage the listener to consider the specific counseling needs of transgender men. For many girls and women, the menstrual period can be a nightmare. Not only it makes one feel more lethargic and weak, but many of them experience debilitating cramping. And for the boys and men, you are familiar with how often some of your female peers complain about painful periods. As a matter of fact, it is not uncommon for girls and women to have cramps during their menses. It was reported that as many as 86% of women in Malaysia said that they have ever had period pain, and a significant portion of this group of women claim that the menstrual cramps has affected their ability to work. While menstrual cramps can seem very common among the women, it should not be taken lightly as it can affect the quality of life or even signal an underlying health issue. Stay with us as we find out together what's the deal with painful periods. This podcast is made by the team at Doc2S. Doc2S is your personal pocket doctor at your fingertips. With its name synonymous to talk to us, Doc2S is a mobile application that allows you to talk to a doctor or any healthcare professionals via text chat at any time and from anywhere. Download Doc2S app on Google Play Store or Apple App Store today. You can also find us on My Sejahtera app, where we are the only telemedicine company that provides free virtual health advisory for COVID-19. Now back to the show. Menstrual cramp, or clinically known as dysmenorrhea, is painful menstruation. Dysmenorrhea can be classified into primary and secondary dysmenorrhea. Primary dysmenorrhea refers to painful menstruation without any obvious disease that could explain the pain. Meanwhile, secondary dysmenorrhea refers to painful menstruation of which the pain can be explained by an underlying pathology, such as endometriosis. That is the tissue that normally lines the inside of women's uterus, grows outside of it. Ouch. For those who have ever experienced painful menstruation, you know how awful it is. But for the sake of those who don't, dysmenorrhea can be described as such. The pain typically starts 1 to 2 days before or with the onset of menses, and then gradually diminishes over 12 to 72 hours. It usually happens in every menstrual cycle. The pain is usually crampy and intermittently intense, but may be a continuous dull ache. The location of the pain is confined to the lower abdomen area, nearby the hip. Some women may also have severe back or thigh pain. The location of pain is important as pain involving other areas may signal other diseases and not dysmenorrhea. Take note! And before anyone dismisses the painful periods as a small matter, be reminded that the pain in dysmenorrhea is no joke. The severity of the pain ranges from mild to severe. In fact, a comprehensive review of a large group of women in their reproductive age has found that 2 to 29% of the women studied experienced severe menstrual cramp. The typical drill for painful periods is well known. Apply hot packs or make yourself a hot cup of ginger tea. Those things work for some women, but that is not always the case. So how is dysmenorrhea being treated clinically? As the treatment for secondary dysmenorrhea requires treatment of the underlying disease, hence, we will only discuss the treatment for primary dysmenorrhea. There are various types of treatment available for primary dysmenorrhea, and the decision on which treatment is adopted will be guided by severity of pain and limitation of daily activities. Typically, if the pain is mild, you can purchase an over-the-counter painkiller, usually in pink color. These types of painkiller contain paracetamol, which relieves the pain, and palmabrom, which reduces swelling and bloating. However, if the pain is so severe that it cannot be relieved by OTC painkiller, then you should see a healthcare professional. In such cases, non-steroidal anti-inflammatory drugs known as NSAIDs will be given. NSAIDs is a group of various drugs which is commonly used as painkillers. They are more effective than paracetamol at relieving pain. Some examples of NSAIDs are naproxen, ibuprofen, and meloxicam. With that being said, women who take NSAIDs need to be aware of its side effects such as gastric irritation. There is also non-painkiller option for dysmenorrhea, and that is a hormonal contraceptive pill. For women who experience painful periods while also would like to adopt contraception, this will be an ideal choice. It can also be used alongside with NSAIDs to manage menstrual cramps. Contraceptive pills prevent menstrual pain by suppressing ovulation, thereby decreasing uterine prostaglandin levels, reducing contraception and cramps. If you experience painful menstruation that disrupts your daily activities, kindly seek medical advice and let the healthcare professional help. You can always talk to us on Doc to Us. Till then, take care and goodbye.